If you're over 60 and your back hurts when you wake up, when you stand too long, or even when you try to sleep, this message could change your life. What if I told you that most seniors don't need expensive treatments, complicated workouts, or painful stretching routines to reduce back pain? In fact, science shows that just 3 simple, gentle exercises done the right way can dramatically reduce stiffness, improve balance, and protect your spine as you age. Back pain after 60 isn't a sign that your body is failing. It's usually a sign that your body has adapted to years of sitting, limited movement, and fear of pain. As we get older, muscles that support the spine weaken, joints lose lubrication, and posture slowly collapses forward. The body becomes cautious. You move less because you're afraid of pain, but that lack of movement actually makes the pain worse. This creates a silent cycle that traps millions of seniors every day. Medical research consistently shows that safe, controlled movement is one of the most powerful tools for reducing chronic back pain in older adults. Not intense exercise, not heavy weights, but slow, intentional movements that wake up the muscles designed to protect your spine. Muscles act like natural braces. When they're weak or inactive, the spine takes all the pressure. When they're gently reactivated, pressure decreases, blood flow improves, and pain signals calm down. Many seniors believe rest is the answer to back pain. Rest feels good in the short term, but too much rest causes muscles to shrink and joints to stiffen. That stiffness is often mistaken for aging, but it's actually deconditioning. The good news is that deconditioning can be reversed at any age. Even people in their 70s, 80s, and beyond can strengthen their backs safely with the right movements. What makes back pain different after 60 is that the goal is no longer flexibility or strength alone. The goal is stability, confidence, and control. These 3 exercises were chosen specifically because they target the deep muscles that support the spine, improve posture without strain, and can be done at home without equipment. They are slow, they are safe, and they work with your body instead of against it. Before we begin, it's important to understand one simple rule. None of these movements should cause sharp pain. Mild discomfort, stretching sensations, or muscle warmth are normal. Sharp pain is not. If something hurts, you reduce the range of motion or stop. Your body learns best when it feels safe. That's especially true for the nervous system, which plays a huge role in chronic back pain. The first exercise focuses on restoring natural movement to your spine. As we age, the spine tends to freeze into one position, usually slightly bent forward. This puts constant pressure on the lower back. Gentle spinal movement helps rehydrate the discs between your vertebrae, improves circulation, and reminds your brain that movement is safe again. You can do this exercise on a bed, a mat, or even a carpeted floor. If getting down to the floor is difficult, a firm mattress works just fine. Lie on your back with your knees bent and your feet flat. Let your arms rest comfortably at your sides. Take a slow breath in through your nose, and as you breathe out, gently flatten your lower back into the surface beneath you. You're not forcing anything. You're simply allowing your back to relax downward. Now, as you breathe in again, gently arch your lower back just a little, creating a small space between your back and the surface. Think of your spine like a wave, slowly moving up and down. This is not a stretch, it's a motion. Slow, controlled, and calm. You move with your breath, not against it. This movement wakes up the deep, stabilizing muscles of the spine, especially those that often go dormant with age. Studies show that slow spinal motion like this reduces stiffness and improves pain perception by calming the nervous system. Many seniors notice relief within just a few repetitions. You continue this movement for about 1 to 2 minutes, breathing slowly. The goal is not repetition count, but smoothness. If your back feels stiff at first, that's normal. With each gentle movement, the spine becomes more cooperative. What's powerful about this exercise is that it teaches your body that movement does not equal danger. Chronic pain often exists not because of damage, but because the brain has become overprotective. Gentle motion retrains that response. Once you finish, you don't jump up right away. You pause, you notice how your back feels. Many people report a sense of warmth or lightness. That's increased blood flow. That's healing beginning. The second exercise is one of the most important movements for seniors with back pain, yet it's often overlooked. This exercise strengthens the muscles around your hips and pelvis, which directly reduces strain on your lower back. Many people don't realize that weak hips force the lower back to do extra work. Over time, this overload leads to pain, stiffness. As we age, the muscles on the sides and back of the hips tend to weaken faster than almost any other muscle group. This affects balance, posture, and the way we walk. When these muscles are inactive, the spine becomes unstable. The body responds by tightening the lower back muscles, which creates that familiar aching or pulling sensation many seniors feel after standing or walking. This exercise is gentle, controlled, and safe, even for people with limited mobility. You can do it on your bed, a couch, or the floor, whatever feels most comfortable. Lie on your side with your knees bent slightly and your head supported. Your body should be in a straight line, not curled forward or leaning backward. Take a slow breath in. As you breathe out, gently lift your top knee a few inches while keeping your feet together. The movement is small. You are not lifting high. You are simply activating the muscles deep in the hip. Imagine your hip muscles turning on like a light switch. Hold for just 1 or 2 seconds, then slowly lower the knee back down. Move with control. No swinging, no momentum. This slow pace is what makes the exercise effective and safe for seniors. You might feel this in the side of your hip or slightly into your lower back. That's a good sign. It means the muscles that stabilize your pelvis are waking up. These muscles help keep your spine aligned when you walk, stand, or turn. You repeat this movement slowly about 8 to 10 times, then switch sides. If 8 feels like too much, you do fewer. Quality matters more than quantity. Research shows that slow, low repetition strengthening improves muscle activation in older adults better than fast or forced movements. This exercise helps reduce back pain in a very specific way. By strengthening the hips, the spine no longer has to compensate for weakness. Pressure is redistributed. Movement becomes smoother. Many seniors report that their back feels more supported after just a few weeks of consistent practice. There's another important benefit here. Strong hip muscles improve balance and reduce the risk of falls. Falls are one of the biggest health risks for seniors, and weak hips are a major contributor. By strengthening these muscles, you're not just helping your back, you're protecting your independence. While doing this exercise, keep your breathing relaxed. Holding your breath increases tension in the body, especially in the lower back. Calm breathing tells the nervous system that you are safe, which helps reduce pain signals. After you finish both sides, slowly roll onto your back or sit up at your own pace. Notice how your body feels. Many people feel more stable, as if their lower body is better connected. The third exercise is often described as one of the safest and most effective movements for seniors with back pain because it strengthens the muscles that keep you upright throughout the day. These muscles support your spine when you stand, walk, cook, or wait in line. When they're weak, your posture collapses, your back works harder, and pain slowly builds without you even realizing it. This exercise looks simple, but it's powerful. It trains endurance rather than force, which is exactly what the aging spine needs. You can do it near a wall, a sturdy chair, or a kitchen counter for support. Safety always comes first. Stand with your feet about hip width apart. Lightly hold onto the chair or counter with one hand. Your knees are soft, not locked. Imagine a string gently pulling the top of your head upward, lengthening your spine without stiffness. Your shoulders are relaxed, not pulled back forcefully. Now, slowly shift your weight evenly through both feet. Take a slow breath in. As you breathe out, gently tighten your lower abdominal muscles, as if you're zipping up a comfortable pair of pants, not sucking in, just supporting. This activation helps stabilize the spine from the front, reducing pressure on the lower back. Once you feel stable, gently lift one foot just a few inches off the ground. You're not trying to balance perfectly. You're simply asking your body to engage the muscles that keep you upright. Hold this position for 5 to 10 seconds, breathing calmly. Then slowly place the foot back down and switch sides. If lifting a foot feels too difficult, you can simply shift more weight onto one leg without lifting. That still activates the same muscles and provides benefit. Remember, the body responds to intention and control, not intensity. This exercise strengthens the deep postural muscles along the spine, hips, and abdomen. These muscles act like a natural corset, supporting your back during daily life. Studies show that improving postural endurance significantly reduces chronic back pain in older adults, especially pain that worsens with standing or walking. As you practice this movement, you may notice small shakes or wobbles. That's not weakness, that's your nervous system learning. These tiny corrections are how balance and strength improve. Over time, standing feels easier and the constant strain on your lower back decreases. You repeat this movement 3 to 5 times on each side. That's enough. More is not better. Consistency is what matters. Doing this exercise daily, even for just a few minutes, sends a powerful message to your body that it is capable and supported. When all 3 exercises are combined, something important happens. The spine regains movement. The hips provide strength. The posture becomes stable. Back pain no longer controls every decision you make. Simple tasks feel less intimidating. Confidence slowly returns. Many seniors worry that exercise will make their pain worse, but the right exercises, done slowly and safely, do the opposite. They reduce fear, improve circulation, and remind the body how it was designed to move. One of the most common questions seniors have is how often these exercises should be done. The answer is simpler than most people expect, and it's also why these exercises are so effective. You don't need long workouts, and you don't need to push yourself to exhaustion. Your body responds best to small amounts of safe movement done regularly. For most seniors, doing these 3 exercises once a day is enough. If daily feels like too much at first, every other day still provides benefits. The key is consistency. Research on aging muscles shows that frequent, low-intensity movement improves strength and reduces pain more effectively than intense sessions done occasionally. Each exercise takes only a few minutes. Together, the full routine can be completed in about 10 to 15 minutes. That short amount of time makes it easier to stay consistent, which is what truly changes how your back feels over time. Another important factor is timing. Many seniors find that doing these exercises in the morning helps reduce stiffness and makes movement easier throughout the day. Others prefer doing them in the evening to release tension built up from daily activities. There is no wrong time. The best time is the time you'll actually do them. It's also important to understand that progress with back pain is not always linear. Some days you may feel great, other days you may feel stiff again. That doesn't mean the exercises aren't working. The aging body responds in waves. What matters is the overall trend, not how you feel on any single day. As these exercises become familiar, your movements will feel smoother. Your posture may improve without effort. You may notice that getting out of a chair, walking, or standing for longer periods feels easier. These changes often happen gradually, which is why many people don't notice them until they look back and realize how far they've come. There's also a psychological benefit that often goes unnoticed. Chronic back pain can make people fearful of movement. That fear leads to tension, which increases pain. Gentle exercises like these help rebuild trust between the mind and the body. When you move without pain, even briefly, your brain begins to relax its protective response. It's important not to rush progress. Adding more exercises or increasing difficulty too quickly can irritate the back and slow healing. These 3 movements were chosen because they work together. Doing them well is far more effective than adding more. Another mistake many seniors make is stopping as soon as the pain improves. Pain relief is wonderful, but the real benefit comes from maintaining strength and mobility over time. Think of these exercises like brushing your teeth. You don't stop once your teeth are clean. You continue to protect them. One of the most reassuring things about these 3 exercises is that they can be adapted to almost every senior, no matter their age or physical condition. Whether you're in your early 60s, late 80s, or even beyond, the body can still respond positively when movements are adjusted with care and respect. If getting down to the floor feels unsafe or uncomfortable, the first exercise, the gentle spinal movement, can be done on a firm bed. The goal is not the surface, but the motion. Even very small movements still stimulate circulation and reduce stiffness. If bending the knees causes discomfort, you can place a pillow under them for support. For the second exercise that strengthens the hips, seniors with limited mobility can reduce the movement even further. The knee only needs to lift slightly, sometimes just an inch, to activate the muscles. If lying on your side is uncomfortable, a rolled towel behind your back can help keep you stable. The focus is muscle activation, not range of motion. For the standing balance exercise, safety is always the priority. Holding onto a counter with both hands is perfectly acceptable. Some seniors prefer standing near a wall or even inside a doorway for added support. If lifting one foot is too challenging, shifting weight side to side still strengthens the same stabilizing muscles. For seniors who use a walker or cane, these exercises can still be beneficial. The standing exercise can be done with the walker directly in front of you. The idea is to build awareness and gentle strength, not to test limits. It's also important to listen to how your body responds over time. Improvement may show up as less stiffness in the morning, less fatigue after walking, or feeling more confident standing. Pain reduction is often gradual, but functional improvements usually appear first. Age-related changes like arthritis or disc wear do not automatically mean pain must worsen. Many studies show that people with visible spinal changes on scans often have no pain at all. Pain is influenced by movement, strength, circulation, and the nervous system. That's why these exercises are so effective. They address all of those factors together. Another important point is mindset. Viewing these exercises as self-care rather than treatment changes how consistently they're done. You're not fixing a broken body. You're supporting a body that has carried you for decades. As weeks go by, these movements can become part of your daily routine. Just like brushing your teeth or making your morning tea, they don't need motivation. They simply become a habit that keeps your back comfortable and your body confident. Now that you understand how adaptable and safe these exercises are, there's one final piece that ties everything together: the long-term impact of keeping your back strong and mobile as you age. When seniors commit to these three simple exercises, something deeper than pain relief begins to happen. The body starts to move with less hesitation. Everyday tasks feel lighter. There's less second guessing before standing up, bending slightly, or going for a short walk. That quiet confidence is one of the most powerful signs of real improvement. Back pain after 60 often steals independence slowly. First, you avoid certain movements. Then you limit activities. Over time, life becomes smaller. These exercises work in the opposite direction. They gently expand what feels possible again, not by forcing change, but by allowing the body to remember how to support itself. Science consistently shows that the spine thrives on gentle movement and stability. When the muscles around it are active, the joints are protected, and the nervous system stays calm. Pain signals decrease not because the body is fixed, but because it no longer feels threatened. These three exercises cover the most important needs of the aging back. The first restores motion and reduces stiffness. The second builds strength where the back needs support the most. The third improves posture and endurance so daily life becomes easier. Together, they form a complete system that works quietly in the background of your life. The most important thing to remember is that your body is not too old to improve. Age does not disqualify you from feeling better. Many seniors experience their biggest improvements not in their 40s or 50s, but later, when they finally begin moving in ways that respect their body instead of fighting it. If you ever miss a day, that's okay. If progress feels slow, that's normal. What matters is continuing gently. Pain didn't appear overnight, and it won't disappear overnight either. But with consistency, these small movements create big changes over time. Your back doesn't need punishment, it needs support. And with just a few minutes a day, these three exercises can help you move through your days with less pain, more confidence, and greater freedom. If you're over 60 and living with back pain, remember this: your body is not broken. It's responding to years of habits, movement patterns, and fear that slowly built up over time. The good news is that it can respond just as powerfully to gentle, consistent care. You don't need dozens of exercises. You don't need expensive equipment. And you don't need to push through pain to get results. These three simple movements work because they respect how the aging body heals. They restore motion where stiffness lies, build strength where support is missing, and create stability where confidence has faded. The most important step is starting, and starting gently. Even 5 to 10 minutes a day can begin to change how your back feels, how you move, and how confident you feel in your body again. Over time, those small moments add up to easier mornings, steadier walking, and less fear of pain controlling your life. If this helped you understand your back pain in a new way, take it as a sign that your body is still capable of healing. Stay consistent, move with patience, and give yourself credit for every step forward, no matter how small. Your body has carried you this far. With the right care, it can carry you comfortably for many more years to come.